Good afternoon, everyone, and welcome to The Upside. Our show is about to begin, and I'm very excited to introduce our co-host today, Beth Goldsmith, Chair-elect of the Associated Jewish Federation of Baltimore. Dr. Scott Rifkin is traveling today, so Beth and I are going to do the show. Beth, take it away and introduce our wonderful guest.
Thanks, Jonathan. And again, welcome to The Upside. And I am very proud to say that as of July 1st, I am actually the chair of the board of the Associated. And today, this virtual show of ours, sponsored by the Associated Jewish Federation, Jewish Federation of Baltimore and JMOR Magazine, is designed to keep the Baltimore Jewish community informed during these uncertain times. Today, we'll be talking with Baltimore County Executive Johnny Olszewski. We'll be asking him questions that are actually on all of our minds, from what's going to happen this upcoming school year to the job market and more. Jonathan, back to you to introduce our guest.
All right. Well, thank you, Beth. So as I said, we are thrilled to welcome Johnny Olszewski to our program today, a lifelong Baltimore County resident. Johnny O, as many of you know him as, graduated from Goucher College and became Baltimore County Executive in 2018. And as County Executive, he has focused on education, making government accountable, and now on keeping community members safe. So welcome, County Executive.
Thanks, Jonathan, and Beth, congratulations to you.
We're excited to be here. Beth, do you want to start with some questions for our County Executive?
Sure. And I wanted to do my own little welcome to you as a fellow Goucher grad. It's so nice to be working with you in another area of our lives. Anyway, tell us, how has opening been going?
It has certainly been a challenge that I had not expected when I ran for this office. We were focused on doing things like building schools and making government more nimble and transparent and responsive to our communities. But leadership is about stepping up in times when we have to. And that's what we've been trying to do in Baltimore County. We have an outstanding team, but it has forced us, just as it has forced families and businesses and nonprofits to think about things in wholly different ways and to really reinvent how we provide services, how we interact with the public. And so it's everything from changing our county's first ever county stat team into a COVID stat team, where we now track metrics on PPE and testing and positivity rates, to serving our residents virtually. You know, we are in the process of trying to move back to reopening county government, but we are, in the meantime, we know that needs continue in the community. So we try to keep serving through teleappointments and other virtual opportunities. We recognize that there's incredible health and economic needs out there. So whether it's food distribution or small business grants, we've really tried to retool. And I have to say, it's in some ways, I've also, even though it's been sort of very difficult to see the food insecurity, to see the people who are experiencing unemployment, there have been some silver linings that I've tried to really take to heart, whether it's personal, like being able to be at home at most evenings, since there really aren't any large events in the evening that I'm required to be at, and spending time with my wife and my daughter, or just seeing how responsive and nimble and resilient this Baltimore County government has been, and how inventive some of our employees have been, and how much they care, showing up on Saturdays for food distributions and being involved. So this is certainly a challenge to all of us, but it's been, in many respects, a very rewarding time too. And I feel very lucky to have the opportunity to be leading in this moment.
So talk a little bit about some of the services that the county's really been able to provide its citizens during this time of COVID. And maybe you could elaborate, on some of those. And also, I think it's really important, because this is a wonderful forum as we simulcast on the Associated and JMOR's Facebook page. If county citizens need help today, can you also tell them how they can go about accessing that help from the county?
So we have a lot of ways for residents to reach out to us, to whether it's calling our 311 number, which is staffed most of the time, and really can be sort of a place where people can triage. We also have various websites where people can visit to check out information, but if they generally want to go to just the baltimorecountymd.gov/coronavirus site, there's all sorts of resources there. And so there's whether it's food insecurity and to date, we've partnered with Baltimore County Public Schools and other vendors, and that's baltimorecounty.md.gov/food help. We've distributed over 3.5 million individual meals to date. We've done it with great partner networks and other organizations that are out there, the Maryland Food Bank, Keeney Foods, H&S Bakery has donated a whole lot of bread to be distributed with our other produce. So it's been really rewarding there. In addition to the food, we have testing sites throughout Baltimore County. We have 5 testing sites. They're both drive-in and walk-up. Residents, if they're not getting it through their own health provider, there's a standing order from Dr. Gregory Branch, our health officer, so that there's no doctor's order required or doctor's appointment necessary. You can schedule online to get a free test here in Baltimore County. Our positivity rate is now under 5%, which is the guideline for reopening. And we are in line with phase 2 of the state's reopening at this point. We're fully in line with what Governor Hogan is allowing. And so our positivity rate has been trending in a very positive direction, for lack of a better term. We have now tested over 10% of our population, which was another metric set out by the governor. We have a very significant supply of PPE for our employees. And we also know that our nursing homes have been hit particularly hard. So we actually are also in partnership with our nursing homes and long-term care facilities, even though they are state state oversight of those facilities, that we have been giving them PPE because nearly 80%, unfortunately, nearly 80% of our fatalities have been associated with nursing home and long-term care facilities, which sort of jives with the fact that we know that people who are most vulnerable are those who are older and more elderly, and also those who have underlying conditions. So, we're trying to meet the needs wherever it exists. We have ongoing conversations with business sectors. We've put out over $10 million of grant awards to help the smallest of businesses who weren't eligible for the federal grants like the PPP or the EIDL. We'll be announcing, this is new, look for it in the upcoming days, a reimbursement program for some of our service sector businesses that are trying to keep their patrons safe by putting in plexiglass shields or carry-out windows where the county is going to use some of our federal CARES dollars to help make sure that people, as we reopen, that we're doing so safely. But you name it, we're looking at it. Eviction prevention. We announced $1 million in eviction prevention, and that was quickly oversubscribed. So we put out another $1 million just yesterday. And we also put out $2 million for nonprofits and other organizations to be thinking about ways to help people stay in their home and stay healthy and safe. So really, wherever the need is, local government, I say, is literally where the rubber meets the road. Crises tend to start local and end local, and we're committed in Baltimore County to doing all that we can to meet the needs that are out there.
Thank you. Beth, you want to jump in with a question or two?
Yes, and so I'm going to jump right into education. And what's the plan of action for Baltimore schools this year?
That's a great question, Beth. And, we know a lot of parents are anxiously awaiting word for what's going to happen here in Baltimore County and across the state. These are decisions that are actually made by the superintendent of schools for Baltimore County and the school board, along with the state superintendent, the state school board. So I guess depending on how you're looking at it, fortunately or unfortunately, the county council and the county executive are not making those decisions. That being said, I do hope that as these plans are being made, and parents need to know soon, that we're putting a particular emphasis on both the long-term needs of our students and our parents, especially those working parents who have very little option, and parents who may be put in a position where, absent having an in-school option, they're going to be choosing between, do I stay home and not go to work? Do I have to go to work and then pay for childcare that I already can't afford? To help with the on-school and online learning. It's certainly a challenge, but I think that we've spent so much time, at least from where I sit as a former teacher and as county executive, we've spent so much time thinking about how do we open up business safely. In Baltimore County, we've been able to open up our summer rec program safely. We're putting in precautions and safety measures. I think we have to have that same sense of urgency to provide an in-school option for all of the parents who want it. And that's thinking about how do we separate our kids? How do we use space differently? How do we provide PPE? How do we ensure hand washing? How do we provide testing as necessary? How do we contact trace? We have all the tools because we're doing it elsewhere. We've been reopened now in Maryland for several weeks, and our numbers have actually continue to trend in a very positive direction. We've seen other places like the YMCA have hosted thousands of kids this summer through childcare, and they've had no outbreaks. We've seen other countries do it. There have been no outbreaks. It's not so much the what, it's more of the how. And so I actually am encouraging and hopeful that both state and local leaders in the education system will be spending more time thinking about how to get our kids the opportunity to be in school this fall. Certainly there are some students or families who might be at risk. So I think we also have to think about digital options for those kids, but then we also have to pair, I get excited about education if you can't tell, where we can pair the teachers who do best with distance learning with the students who either need it or do best with distance learning, right? So just like anything else, there are going to be some teachers who are better in an in-class environment versus at a digital environment, and there are some kids who either need the digital environment or thrive better in it. And so, given where we are with COVID, what's the infrastructure to support primarily in school instruction, but then also what are the additional digital supports that we need to provide for those children who can't or do better from digital opportunities. So a lot there to unpack, but again, we're figuring it out in these other spaces. There's no reason we can't figure it out locally in schools. And again, with parents having to make decisions about their work, vacations as summer ends, childcare, we really got to get it also figured out soon and communicate at least what our intentions are, even if we don't have it all figured out.
So, here's a follow-up, Mr. County Executive. So, you're a former educator, you're the county executive, but you're also a dad, you're a husband. What did you tell your daughter when this all began? Because I'm sure she looks at you as, you're like this superhero leader, but you're also dad. What were those conversations like?
Well, cute, funny story. Sometimes when we're out and about, just walking around our neighborhood, Daria, my daughter, will introduce herself, and she does what a 4-year-old does. Hi, my name's Daria Olszewski. My daddy is county executive. But I do think about her, and I think about all the other kids at the county, and she's not yet enrolled, but I think about what would I want for her, and I sort of said when I ran for this office, I called it the parent test. And I think at our most basic level, we can all relate to that. Is this an environment that I would want my child to be in? And what would I want for my child? And so I've tried to have that lens as I've toured schools, as we've tried to respond to the educational needs through this crisis. And I think that is sort of the guidepost that I use. So I think it's a good point. And then, sort of similarly, what are the protections I want for my family? What do I want for my wife and my daughter? How do we stay safe and avoid the challenges for myself and our extended family? And it really is the guidance we've been issuing. It's having the robust testing operations that we have throughout the county. It's having access to PPE and making sure that people are wearing masks when they're not sort of out in public, and in close quarters in particular, that people are practicing social distancing, and that if folks test positive, which is why we had the testing, then we do the strong contact tracing so that people who are COVID positive know about it, share that with their networks, they get tested, they get quarantined, because if we can keep tamping down the spread, absent a vaccine, which does not exist, right? This is the best thing that we have to make sure we keep everybody safe. And so, it's sort of I want for my family what I want for all of the residents that I'm responsible for here in Baltimore County.
Great. Beth?
Yeah, I would follow up a little on a few things. One, I'd love to hear more about contact tracing, how it's actually working. And you're speaking about the schools being under someone else's control, actually. Makes me think of lots of little things, like wearing masks, for instance. What are suggestions? What are rules? Who enforces? Are there ways to enforce those kinds of things? I get it, maybe inside a school, former teacher also, that,
and former Goucher guy. We've got all kinds of similarities here, Matt.
Of course, I was a Goucher girl. You weren't allowed there back when I went. But so talk a little about I guess, where the responsibility actually falls?
So the answer is it depends on both what's required and who enforces it. In terms of requirements, because we've aligned fully with the state, the places that require masks are now by directive of the governor's executive orders. My executive orders under the state of emergency now mirror the governor's. So there are places, there are some retail establishments. In particular, I think about things like barbershops and beauty salons, where you are required to wear a mask as part of the process to be there to make sure that, where you're in close contact, you are limiting the opportunities for spread. And then, there are other places where it's not required, but it's just suggested. I mean, I think the suggestion is pretty much anywhere you go, mask wearing is recommended. And anywhere you go, social distancing is recommended. There are some places where it's required. In terms of enforcement, we have locally, we're the ones who are being asked to enforce. And we have a social distancing task force that's part of our emergency operations center, which has been operating longer than I think in the history of Baltimore County. It's normally meant to respond to things like the storm that we had last night, where we have floods or strong storms, and we sort of coordinate with BGE and the Red Cross to clean up streets and serve some families. But our EOC is now all virtual. It's been up for a very long time. And they have a work group and a task force that's made up of fire, police, and the health department that are going out as we get requests. So we're complaint driven and doing enforcement. We're leading with education. So we're trying to first, whether it's a restaurant or a small business, to say this is what's required or this is how you do it more safely. And then if there are violations, sometimes it might be the fire marshal, sometimes it might be our permitting office. Police is our last line of action in the social distancing task force. And I have to say, by and large, we've had only a few dozen actions that have had to have been taken. People have largely complied voluntarily, even before there's been a complaint, but certainly after. I want to really commend the residents and the businesses of this county who have really responded and understood that this is a serious disease. It's a deadly virus, and that we really need to take it seriously. And to the point of contact tracing, I know we've heard the term a lot recently, but we've long had a long existing contact tracing operation here in Baltimore County. We've been expanding that work. We've hired dozens and dozens of contact tracers locally. We're also working in partnership with the state. The way it works currently is the state has a call center, and they sort of track what we call the easier cases where people are responsive and give all the information. Our 70 or so contact tracers locally handle the bulk of the more difficult cases where we have to go knock on doors or track people down and do additional follow-ups. But we were the first in the state to stand up a contact tracing program. CCBC here in Baltimore County has a free online contact tracing certification. So it's a critical tool in this fight. And if anyone's interested, they can go to CCBC and become a contact tracer. Our jurisdiction, other local jurisdictions in the state have been hiring. So for those who are looking for job opportunities, it's another place where we're trying to, again, be inventive but also meet a critical health need out there.
So County Executive, here's a question. We look around the country, and right now states are in various areas of challenge. There's a lot of states where it's trending upward. Thank goodness ours is very stable here. But as you look to a possible upsurge in the fall, winter, which would be everyone's worst case scenario, worst nightmare here in Maryland, what are you all doing to plan for that possibility?
Yeah, it's a really good question, Jonathan. And I have to say, I'm proud of what we're doing. So in addition to where we've been, we're also thinking about where we might be going. So we do have additional sites set up for further testing should we need them. We struck a partnership, again, the first of all counties in the state with BD Health up in Sparks, Maryland, here in Baltimore County, where we're getting up to 2,000 extra complete ready to go tests that if they're not being used at our existing sites, this was an additive so that we can start stockpiling additional tests. We are also stockpiling our PPE and having a larger supply chain for the long haul. We have, again, I think having this contact tracing program in place is helpful. We're ready to ramp that up if it becomes more necessary. Really, we're doing all that we can to avoid that, because what we don't want to do is get to a place where we have to wind back our reopening. We know that businesses have struggled so much already, and our nonprofits have struggled so much already. That's why we're trying to be slow and deliberate and data driven. It's why we have a COVID stat program and not just the county stat program anymore. And we're measuring, again, not just cases, but positivity rates, hospitalization, ventilator usage. We were talking twice a week with our hospitals. We've been able to wind that down to weekly communications, but we are in touch with all of the relevant folks who are on the front lines of this. And we're doing all that we can to prevent that second spike, but we're also, part of it is just the sharing that information and doing the public outreach. And sometimes I feel like I'm a broken record, because I do keep repeating about the fact that we all have a role to play, that people have to keep themselves and their families safe by wearing masks, keeping socially distant, getting tested if they've been, in large crowds or exposed. Because really we've made so much progress, and really, particularly, as you pointed out, as we compare ourselves to other countries that are seeing historically high numbers through the start of this, we've maintained our leveling off at lower rates. And in Baltimore County, our numbers are the lowest they've been since we really started this pandemic, since numbers started going up. And we've done that as we've reopened. And we can't take that for granted, but it is very encouraging, and we have to stay vigilant so that we can sustain the progress we've made in the fight against this virus as we work towards hopefully having a vaccine at some point in the months ahead.
Great. Beth?
Do you see a big difference? I guess this is sort of an obvious question. We in Northwest Baltimore are basically, just bordering on the city line, but Baltimore County is much bigger place.
Yep.
Are there areas of the county where things are better, worse, and how are we dealing with that, the demographic split?
Yeah. So this gets back to the data-driven piece of our government and our response to COVID. We absolutely see hotspots across Baltimore County. So we are tracking that. And that's basically how we've decided to set up our testing centers. It's where we're focusing some of our outreach efforts, because we know that, again, it's about testing, tracing, getting the information out. Some of the places, so the more rural parts of the county, so northern Baltimore County, for example, have typically been less, but that's because there is sort of built-in social distancing largely in those places. But again, there have been some more urban communities that have done a fantastic job with mask wearing, with proper protocols to actually avoid large spikes. So it's not just rural versus urban. It's really about how people have responded. And, we're also doing things, particularly in these high number areas, of providing care kits at testing centers, and our food sites, making sure that vulnerable communities in particular are aware of their risks, but also providing them with the resources to avoid contracting the virus as best we can. So absolutely. And I think this sort of speaks to one of the challenges we saw, Beth, as we try to coordinate with the city and other counties through the reopening. Maryland has this sort of bifurcated system, or had this sort of bifurcated system, where there were different counties doing different things that the governor had allowed. And, initially we only held back for a very short period of time as part of the phase 1 reopening, because we did not have the testing and the PPE and the contact tracing stood up. We were very aggressive once the governor said he wanted to reopen, to get those things in place. And ever since we followed, because we knew that having different sets of rules both first of all, it confused the public and our businesses about what was allowed where. It put our businesses on different playing fields against Harford or Carroll County, for example. And in some instances, it's, as you mentioned with Baltimore City, it's a 2-minute drive difference. And then third, because there were different rules, the public health effects were muted. So people could go to Ocean City and still come back to Baltimore County, or they could go get their hair cut in Harford County and then come back to Baltimore County. So we realized that we wanted to just have the pillars in place so we could do it safely. and not discourage people to leave the county. And so we're fortunate that we've been able to get those things in place. We've been aligned with the state since then, because we think that there is some confusion and some unlevel playing fields that would be created by not trying to stay as aligned as we possibly could be.
So I know we have just a minute or two because you've got a pressing, busy day ahead of you, but put that kind of teacher father hat back on. And what do you say to the young people of the county who, all of their summer plans have turned upside down? There's a lot going on in society right now. There's probably a lot of anxiety, but what if you were addressing a room full of, teenagers and middle school students and elementary school students, what words would you leave them with? Is COVID is still with us?
Well, I'd start by saying I'm lucky, or you are lucky that you are digital natives, and that you have all of these resources to survive and stay connected. I'm sort of on the bubble where all of this technology started to come to age, but I would encourage them to use this as an opportunity to think differently. And as we're seeing, the other thing is that we didn't get to, and maybe we can follow up at some point, is the budgetary challenges, the fact that we're having these hard conversations about race now because of what's happening in the wake of George Floyd's murder. But our young people are still finding ways to step up and be leaders, and a lot of it is through digital organizing and through communicating in different ways. And so I think that, two things is, first of all, think differently, but second of all, don't be afraid to go back to basics, right? Don't be afraid to spend time with your family. If you have a close circle of friends that you actually, are close with and can be responsible with mask wearing and social distancing, get back to basics with people you love and really care about too. And I think that strangely, there's a lesson for all of us in that. I think I mentioned it earlier, but just having the time to do dinner almost every night with my wife and daughter has been a blessing. With the exception of maybe some, attending and visiting some food distribution sites on Saturdays, having most of the weekends to do work at home or, virtually attend church, but to just be home and present. I think that there's a real opportunity for our young people. It's certainly something we're going to all remember for the rest of our lives. But I really am. I'm so proud of them and what they're doing and how they've responded to, because we all have, for our graduates, for example, we have this sort of vision of what graduation means and looks like. And so many of them have been able to roll with the punches and innovate and still make it meaningful and special. And I'd encourage them to focus on those kinds of things.
Well, thank you very much. Beth, I'll let you wrap us up.
Yeah, what a great ending. You began talking about silver linings, and I love that we're ending on that same note. I try and think every day of something that's better because of this. For me, I get so much more done in a day because I don't have to drive from here to there to get to happen. My meetings can literally back up against one another, and it's great to be able to do that, as much as I miss being able to hug people. But anyway, thank you so very much for taking the time to be with us. And I just want to wish you luck on behalf of all of us and our county on the future. And we certainly hope that things will continue to go in the way we are all praying for them to go, and for things to just keep getting better. So thanks for your time. Thanks for your efforts. And I'm going to just tell everybody about our next show, which will be Tuesday, July 14th, also at noon. And we're going to be talking to Barack Herman, who is the Chief Executive Officer of the JCC. And we're going to talk again about reopening. They have been reopened. There's camp. So we're going to hear about how things are going and future plans for the J. Everyone, please continue to visit associated.org and jmoreliving.com for more information, stories, and resources, and sign up for the weekly newspaper. And everyone, follow the rules and stay safe.
Thank you, County Executive. Thanks, everyone.
Thanks so much. Thanks, everybody.
Take care. Bye-bye.